We'll discuss another thing, and this is related to severe dehydration in a child that has acute gastroenteritis. All right, so there's a question that was asked, okay, and this question is towards what? Severe dehydration in a child that is having acute gastroenteritis. So they said that a 15-month-old baby was rushed to the emergency pediatric unit by his father. He has had 10 bouts of watery stools and has vomited 3 times the night before they came. The mom said she did not give him any food this morning because she was afraid that the baby will vomit again. The child is not responding to calls and is very weak, with hands and feet very cold to touch. Then the core temperature is about 36. Okay, it's about 36 degrees Celsius, peripheral payload, and 180 for the blood pressure. So what is your immediate diagnosis? Okay, list 5 possible signs you elicit on examination. Outline 5 steps of treating the child. Then what are the predisposing factors? Then how will you prevent your diagnosis? Okay, so let's quickly move. So the child is in hypovolemic shock from severe dehydration due to acute gastroenteritis. That's just it. So immediate diagnosis is severe dehydration with hypovolemic shock secondary to acute gastroenteritis. Okay, so clues is they have had watery stools more than 10 times, repeated vomiting, they are lethargic, they are unresponsive, they have cold extremities, they are weak, hypothermia, they are tachycardiac. Okay, the blood pressure is about 180, peripheral payload. Okay, so 5 other possible signs you actually be looking out for in such a patient is if they have sunken eyes due to the dehydration, delayed skin turgor, sunken or depressed fontanelles, weak or thready pulse, prolonged capillary refill that is more than 3 seconds. So other signs is they can have a dry mucous membrane, they can have reduced urine outputs, rapid breathing, lethargy or coma. Okay, so steps in management of such a child is what? You have to resuscitate. So airway resuscitation, breathing, you have to give oxygen. Circulation, you have to ensure that an intravenous access have been picked up immediately. So you give intravenous fluids like 20 ml per kg of isotonic fluids like normal saline or Ringer's lactate for between 15 to 20 minutes. Repeat up to 2 to 3 times if they are still in shock. Right. So you correct dehydration by giving intravenous rehydration about 100 ml per kilogram over 3 hours for a child that is more than 12 months, over 6 hours for a child that is below 12 months. So if they are hypoglycemic, the right fluid to use is 10% dextrose. Okay. Treat electrolyte imbalance. You monitor the sodium and potassium. You replace potassium, okay, if the urine output is adequate. Then for the acute gastroenteritis, you treat it. Okay. So if it is caused by bacteria, of course you indicate it from blood diarrhea, suspected cholera, severe malnutrition and sepsis. Use antibiotics. Alright. Monitor the vital signs. Check out for the urine outputs, levels of consciousness, capillary refills. Okay. You resume the feeding. Okay. Normally once they are stable. okay, you continue breastfeeding. So 5 predisposing factors that could have made that baby have that acute gastroenteritis is if there's poor sanitation, or if the water around them is contaminated, if they are malnourished, if there's lack of exclusive breastfeeding, poor hand hygiene, inadequate immunizations, if they live in an overcrowded area, if there's poverty, okay, bottle feeding with unclean water and all of that. So you prevent it by giving exclusive breastfeeding, then good hygiene, you immunize, proper sanitation. Health education is basically, the healthcare giver should know about diarrhea, should know about oral rehydration solutions and everything involved in resuscitating that child.